All right, we're live.
All right, good morning, everyone. This is the Senate Health and Welfare Committee meeting. It is March 30th, and we're going to this morning look at the governor's recommended appointments for various positions within the Agency of Human Services and other areas of state government under our jurisdiction. So thank you all for being here. We have heard testimony from each of the folks that Nellie has listed in the chat for us to make it simple access. So I thought what we would do, we'll go right through the list, and if there are any questions, concerns, or comments about any of the appointments, this is an opportunity to have those, and then I would entertain a motion for approval or disapproval, for recommendation for confirmation or not. So we'll start out with Mike Smith, who is currently Secretary of the Agency of Human Services, and the governor is recommending for reappointment to that position. Any discussion, committee? Senator Hardy.
I think that, thank you, Madam Chair. I think Secretary Smith is clearly very qualified for his position. I think this is his second round doing this job, right? He did it also for Governor Douglas. And his resume is extensive. I just, for the record, am frustrated with his position on not vaccinating incarcerated individuals in Vermont. I think that is a bad decision, and we would have prevented many of the hundreds of cases that we've had in our prisons throughout the state if they had been vaccinated earlier. So that is a concern about his decision making that I wanted to say for the record. And I also just am a little concerned because for a Secretary of Human Services, he's obviously extremely knowledgeable and very competent and qualified. He doesn't seem to have this sort of warm, fuzzy empathy that I would want to have from a Secretary of Human Services. So if you're listening, Secretary Smith, turn up the empathy measure a little bit. Obviously I'm not going to vote against him, but I just, that would be my suggestion for him, is that a little more empathy would be helpful, especially these days. Thank you, Madam Chair.
All right. Thank you, Senator. Any other comments?
Training. I guess we're into empathy training.
Empathy training. Well, we do have now trauma-informed training in the agency, and someday we'll get back to that when we're out of the pandemic. Okay. Any other comments? Senator Cummings.
Secretary Smith says he does want to be reappointed.
Yes.
Because since I've known him, he's been saying he had to retire.
Yes. Well,
that was, I think, 4 jobs ago.
Well, Senator, he did indicate that there's a nurse in his life who was encouraging him not to continue, his wife, but he's really going against the grain on that one. All right. Is there a motion or further discussion or a motion?
I'll move to approve.
Okay. So the motion is to approve I
guess it's to recommend favorably to the Senate.
A confirmation of. Yes.
Michael Smith as.
And that's Senator Hooker. You are going to take over the clerk's position today.
Yes.
So the motion for each of these is to recommend to the full Senate approval for confirmation of as.
Okay.
In this case, Mike Smith is Secretary of the Agency of Human Services. Probably could be worded better, but.
Okay. So we don't need a second on this?
I don't think so.
Senator Lyons? Okay.
No.
So I will commence to call the roll.
Any further discussion?
Any further discussion?
Okay, go ahead.
Hooker, yes. Senator Cummings,
Yes.
Senator Hardy,
Yes.
Senator Terenzini,
Yes.
Senator Lyons.
Yes.
Yes, the vote is 5-0-0.
Okay, and so now as for each, I believe for each of these, with the possible exception of Jessica Holmes, I'm not sure whether that one gets underlined in the journal or not, but each of these is a floor report. So let's go through all of those and then think about one or more of these. There's 1, 2, 3, 4, 5, 6. So there'll be someone who has 2 of these to report. So each person would be responsible for one person, and that. So think about who it is that you would like to report on. And I have a suspicion that Senator Hardy will not be picking Secretary Smith, but we'll see. All right.
I
I
can
think-
see what I just said on the floor too, you know.
Yeah, I know you
More
could.
warm and fuzzy.
I will. I was thinking that if I might do that one, and I might actually say that anyway. Let's go, Senator Cummings.
Well, I was just going to say, I knew Secretary Smith when he was I believe, Secretary of Administration in the Douglas. And
Yeah.
to say that our relationship was less than warm and fuzzy is probably very accurate. I found him much more warm and fuzzy when I was sitting next to him on the VSAC board. And I wasn't here for his interview this year, but 2 years ago, I found him to be very empathetic and fuzzy. I don't think he'd like that description, but I've come to have a lot more respect and just plain liking of Secretary Smith as I've worked with him in different roles over the years.
So yeah, that's been my experience as well, having gone through now the second time as Agency of Human Services Executive Director of Vital, in the executive with the governor's office as administration secretary.
Burlington College.
Burlington College, right? So there've been
Before
a lot,
that, it was Fairpoint.
and Fairpoint. That's true. Also,
Yep.
he was. I believe he was Fairpoint when I was on finance. So that would have been another intersection. Okay. All right. So let's take up Commissioner Levine, who did interview with us about continuing his position as Commissioner of Department of Health. I'll open it up for discussion, comments, concerns. All right. Senator Terenzini, I'm looking at you because you leaned forward, and then Senator Hardy put her hand up. So I'm going to give Senator Terenzini first crack this time.
I really was only leaning forward to unmute because I figured we would be voting very quickly on this one because
Okay,
I don't know
all right.
how anyone could object to Dr. Levine. So
Is that a
There
motion?
you go.
I'll make that a motion.
All right. Senator Hardy, did you want to add comments?
Yeah, because we had Secretary Smith and Commissioner Levine on the same day, and I think I said to Commissioner Levine something about how like I hear his voice in my head and it's a voice of comfort, and so it's sort of the opposite of he is warm and fuzzy, and just like the perfect kind of voice and calm and competent and just reassuring person to sort of take us through this pandemic. So I agree with Senator Terenzini. I can't imagine anyone being against his confirmation. He's done such incredible work.
All right. So there's a motion on the floor. Any further discussion? All right. Senator Hooker.
Hooker, yes. Senator Cummings,
Yes.
Senator Hardy,
Yes.
Senator Terenzini,
Yes.
Senator Lyons.
Yes.
Again, the vote is 5-0-0 to recommend Dr. Mark Levine.
All right, let's, so we'll move on to Corey Gustafson. And I think for some of you, when Corey was in, Commissioner Gustafson was in, that was your first opportunity to really have interaction with him as Commissioner of DEVA. So I will open it up for questions, comments, concerns. Probably more comments, concerns than questions.
Yeah, that was the first time I think he was in once in
Yep.
finance earlier this
Mhm.
session. Is that true, Senator Cummings? Did we have him into finance for something?
I thought it was health and welfare. I have
Okay.
seen him somewhere this year on
Yeah.
Zoom.
Right. So I think I've only seen him once or twice, and maybe this time he came in was the second time I've seen him testify. So I don't feel like I know him that well at all.
Okay, so I mean, that's a fair comment because we haven't had DEVA in significantly. The issue is as we go forward, we'll be hearing more and more about what's going on in Medicaid. In fact, tomorrow we'll have some comments from Nissa James from the Commissioner's office about that, about one of our bills. But so for those of us who have had experiences and worked with Commissioner Gustafson, I would suggest that he is extremely competent in his role. And as you heard about his background in the insurance industry, has brought a great deal of thoughtfulness, program efficiencies, and also expansion to the people who need it the most. So I think if you're talking about warm and fuzzy, his heart is in the place where people need it. So building the safety net that Medicaid can fully be. And I don't know, Senator Cummings, if you want to add to
I was
that.
just going to say, do you realize we've now referred to a Navy SEAL and a former professional hockey player
I got
as
it.
warm and fuzzy?
Well, there you go. So I would, Senator Cummings, do you want to add any comments to what I've said?
No, I've worked with Corey over the years and have always found him to be very well prepared and able to talk and negotiate, and it's fine.
Certainly has gotten us through the pandemic issues with Medicaid and allowed for some of the work that's so important through telehealth, especially, and reimbursement issues to keep patients in care. Okay,
Okay.
I would look for a motion on Corey Gustafson to be to go to the full Senate for confirmation.
So moved.
Okay, Senator Hooker.
Okay.
So if there's any further discussion, all right, Senator Hooker, the vote.
Okay. Hooker, yes. Senator Cummings.
Yes.
Senator Hardy.
Yes.
Senator Terenzini.
Yes.
Senator Lyons.
Yes.
Okay. 5-0-0 to recommend to the Senate Corey Gustafson for confirmation.
All right. Okay. Commissioner Squirrel, who is currently Commissioner of Department of Mental Health, excuse me. And so we did hear from her as well last week. We have heard from her previously, and we will hear from her quite a bit going forward as we try to resolve some of the mental health issues, including the Middlesex facility replacement, and also trying to expand mental health coverage as a result of the pandemic. So questions, comments, concerns? Senator Hardy.
Yeah,
let's go ahead.
Thanks. I missed her confirmation hearing,
Okay,
but I have known her prior to my time on this committee and have always found her very competent and very knowledgeable and easy to work with. So I would, even though I missed what she said to the committee, I would vote in favor of her.
okay. Other comments?
Certainly, I think that perhaps all of these, this sort of continuity that we need getting through the pandemic is another thing that I would consider. And she certainly has experience, and we know that mental health is going to be a huge issue moving forward. So.
Thank you. The point you made about carrying through the pandemic, I think is a really important one. Knowing that we've got we're still going through Brattleboro retreat, Woodside issues that do extend into the mental health arena, and then as I mentioned before, Middlesex, and then also all the mental health issues within the pandemic. So good thought, Senator. Is there a motion? Do we have a motion?
I'll move.
Senator Hooker has made a motion to approve. I'm assuming that was to approve.
Yes.
Okay. Further discussion? All right. I, for one, look forward to working with Commissioner Squirrel. I was a member of the think tank that lasted for quite a bit of time, working with a significant number of interested parties and stakeholders across the spectrum. That was her initiative that put the think tank together and brought people together to talk about the sort of the 10-year systemic, 10-year plan for mental health. And then the bill that we passed finally, the commission looking forward on mental health. And she's done a great deal of work in some really important planning for the state. So I will certainly support this
Okay.
appointment.
The vote.
Yes, ma'am.
Okay. Tooker, yes. Senator Cummings.
Yes.
Senator Hardy.
Yes.
Senator Tiranzini.
Yes.
Senator Lyons.
Yes.
Okay. 5-0-0 to recommend.
All right. And then we have Sean Brown, Commissioner of Department of Children and Families, who is relatively new. He was appointed in the middle of the pandemic, I guess you would call it. So, but we did hear from him as well. So comments, discussion, Senator Tiranzini.
I was just going to offer Senator Lyons that that was my first or second time virtually meeting Commissioner Brown, but I found his answers to be thoughtful, and I think he offered empathy, as Senator Hardy wants to see, and I felt very comfortable with him, and I just thought he had that sort of the right personality for a job as sensitive as that one. So that was my my take on him.
Thank you. Go ahead.
Yeah, thank you. I do think he does show empathy. My one concern was the one that I brought up when he was here was he doesn't have as much experience in the area of childcare and early childhood education. And I think he acknowledged that, and I felt comfortable with his response. And it's just an area that I hope that he works on, especially as we move forward with continued reforms in the childcare area.
Well, we'll certainly hear from his shop as we take up H-171. So you're right on target. But it's interesting to me, as you know, when we heard from him on the Kern-Hatton issue and the report that we'll get back to sooner or later, that he does rely on his folks in DCF. And so he does have, as he said, he has some good people in the in the department. So that was also reassuring, based on what your thoughts are, Senator Hardy. I agree with you. Any other?
And there are certain issues, certainly issues that have arisen throughout the pandemic with regard to social workers and the things that they're asked to do. I know that he is working on that, I hope. And again, we need to have people who have been working on these issues so that we can continue and come to some resolution for them.
Yes, thank you. You bring up some good points. We will get into the issues on social workers. We've got so much going on. We're going to be here until next year. We may even be back next year doing it. So anyway, all right. Is there a motion? Do I see it here, a motion?
I'll make it a motion.
Thank you. And that's for approval?
Approval of the recommendation to the Senate for Commissioner Brown.
Thank you. All right, further discussion? All right, clerk?
Okay, Hooker, yes. Senator Cummings.
Yes.
Senator Hardy.
Yes.
Senator Terenzini.
Yes.
Senator Lyons.
Yes.
Okay.
All right.
0-0.
And then the last appointment that we have today, I honestly, I don't know whether we'll be getting any more appointments, but these are the ones that we have, and it's really important to act on them so people have a level of comfort in their professional lives. Jessica Holmes, a member of the Green Mountain Care Board.
I'll
Go ahead.
again. I've known Jessica for, I don't know, 19 years. She, as you all know, she's a professor at Middlebury College, and she has kids that are the same age as my kids. So I've known her as a sister mom for many, many years. But professionally, she's also just brilliant. She's just one of those people that you're like, wow, she's one of the smartest people I know. So it's great that she's been involved on the Green Mountain Care Board. And I definitely, as she says, I think she has more work to do. So I wholeheartedly support her return or continuing on the board.
Thank you. I would concur with your comments. I haven't known her as long, but have mutual Middlebury professor type friends who have known her that long. But support her. Other comments? Certainly the work of the board is difficult and has been difficult. I just want to say this because I'm not sure that she brought it up, but the transition of the board from a board that was meant to look at all payer to a board that is meant to be a more regulatory board as we move into whatever challenges we have with the all payer model. So going from single payer to all payer model and other reform efforts, it's a challenge to do that. And so having someone with her expertise in sorting out payment systems, economic issues has been really very important. I would entertain a motion from Senator Hardy.
So moved that we recommend the reappointment of Jessica Holmes to the Green Mountain Care Board.
All right. Very good.
So the
discussion. Any further discussion? Senator Hooker, go ahead.
Nope, just the vote. Okay, Hooker, yes. Senator Cummings?
Yes.
Senator Hardy?
Yep.
Senator Terenzini?
Yes.
Senator Lyons?
Yes.
Okay.
All right, very good. There isn't a lot of controversy about these. I think that what this says to us is that as we've worked through the pandemic with some slight bumps in the road, we've worked through this together with the administration and with people out in our communities. And I think that's really been critically important for the state of Vermont overall. So it is a testament to the legislature as a whole, and also to the folks who are in the administration who've been able to accommodate the people and work for the good of individuals in our state. As I said, with some bumps in the road, Senator Hardy. I know, we get it. And there have been other bumps too, but what's interesting to me is that those bumps have happened as we've gotten closer and closer to the light at the end of the tunnel. So it's fascinating. Someday somebody will have to write a book about that. Mm-hmm. All right, so I'm going through the list now, and is there someone that you as an individual would like to report? And why don't you, everyone, Senator Hardy, do you have someone in particular you would like to report?
Well, I would like to report Jessica Holmes if necessary.
Okay, well, you want to do two, I'm hearing that.
Yeah, I'll do two. I can do two. I'll do her if necessary, and then one of commissioners. I mean, of course, right, well, I'd like to do Commissioner Levine because he's such a sweetie, but I also, if there's somebody else who wants to do him, I don't think I should do Gustafson or Squirrel because I wasn't here for Squirrel's confirmation hearing, and I don't really feel like I know Gustafson well enough.
All right, well, let's see. Senator Cummings, is there someone you would like to report on?
The only one I've worked with extensively is Mike Smith, but he's the secretary, and usually the chair does that.
Yeah, I thought I would do that, but can you do Corey?
Yeah, if you send me the bio. I wasn't there. So Ellie can email me the background information.
Yeah,
I was there for his last confirmation.
Yeah, none of us have anything except what we heard verbally. So I'll ask Nellie to get something to you from. It would
be helpful if they send
I actually have a conversation later today with Corey Gustafson, so I will ask him to send something in.
That would be very helpful.
If I remember. Okay.
There's that.
All right.
Senator Lyons, I'd be happy to do Sean Brown.
Okay.
But once again, do you think we could get with Nellie to ask for a little bit of like a half-page bio that I could use?
Nellie, you're hearing this, so and we'll confirm that afterwards. Yes, it would be nice to have a paragraph about each of these people.
I used to just go up and put it in my desk, and now I don't.
Yeah,
I'll have to keep track of it.
I know.
Just put it on your desktop, Senator Cummings.
So
I don't know how to do that.
Senator Hooker.
Sure, whatever.
Is there someone you would like? The list is narrowing.
And this list is narrowing. I just assign me, and then I will do whomever. That's fine.
Okay, so you have a choice of Commissioner Squirrel or Commissioner Levine.
Well, then I'll take Commissioner Levine.
Yeah, I knew you would.
We should give him an Oscar or an Emmy.
I know. Look at Senator Hardy and I both want to do Senator Levine in the worst way, but I'm going to. Senator Hardy would prefer. Can you also do Commissioner Squirrel?
I'm happy to do that. I just wasn't here. I guess I can watch it on YouTube. I just wasn't here for her confirmation thing.
I can do Commissioner Squirrel, and you.
All right. Either way is fine with us. So.
Okay, Cheryl, you'll do Sarah Squirrel, and I'll do Mark Levine.
Yes, you
get
the easy one.
I did the captives bill, so I get this one.
You did the nurse compact bill.
Told you no one would ask questions.
Nobody asked questions. It was fun.
I was going to ask her about the cells, but I didn't. Anyway.
I thought somebody
was going to ask about the cells, so I preempted it with my report.
All right. So, and just so you know, Nellie has indicated to us that she will follow up and ask for simple bios on each of the folks we're reporting on. And then, so Nellie, if you don't have the list of who's doing what, I think Senator Hooker does and I do. So we can distribute that wealth of information when
Yeah.
we get.
I can do that. And so
okay.
I will send a list of the votes and the reporters to the secretary.
No, what we do is each of the reporters will take the vote independently. And I would
Okay.
suggest, yeah, so I would wait. I just, we've done it. So you can do it today if you want to. You can send it to Secretary Bloomer with the vote. But I don't know when we'll vote on these things. You just don't want to be taken by surprise when you don't have the information to present on the floor. That's all.
Mhm.
Go ahead, Ruth.
I was just going to say, maybe since Cheryl was clerk for a day, she could just send it to the secretary for all of us and ask that we do them all on the same day. And then
Well,
we do
we
all
can
of our,
ask,
No?
I can ask for that as chair, and a clerk can ask for it, but each person has to report it to Bloomer. It's just like a bill.
Oh, just like a bill. Okay.
Yeah,
Okay.
he's not gonna take a list from the clerk, even though the clerk is the one who has the information. So it keeps it cleaner too, because then you know that whatever you're doing has been reported to the floor and you're in charge of your own report process.
So I can make a list of, well, the votes were all unanimous, but I can make a list of who's sponsoring and then we'll
That's to
just
Nellie, I think.
send that to Nellie.
Yeah, that would be helpful.
Okay.
Then when she gets the bios, she'll know who gets what.
Mm-hmm. Okay.
Okay, so I'll take care of Secretary Smith's floor report. Senator Hardy's doing Commissioner Levine, Senator Cummings, Commissioner Gustafson, Senator Hooker, Commissioner Squirrel, Senator Terenzini, Commissioner Brown, and Senator Hardy, Jessica Holmes.
Yeah.
There we go. Okay. All right, thank you for that. That was good. And it's nice to have that settled. I thought today would be a good day. I didn't know we'd have so much time today. I'm really nice. So if you have your agenda for the rest of the week, I thought we'd just talk briefly. I just wanted to talk a little bit about where we're headed, because I know that's always a question. And the more you know, the happier you are. We have received a lot of bills. Nellie, do you have the list of bills that we have received in committee? Are they all up to date, do you know, on our webpage?
I believe they are. I haven't checked the bills that were referred today yet. But just they look up to date.
Yeah, I think we have all the bills that we're taking up. I'm not, I want to make sure that we have all the bills that we're taking up. Some of the bills, couple bills we just got today, but we've structured it with the thought that these bills belong in our committee. And so we have them on our agenda this week. This is not the last time that we're looking at each of these bills. I've had requests from people, and so folks who are looking in on Zoom and are interested in testifying on any one or more of these bills. These are bills that we are taking up for the first time this week, and then we'll structure testimony on the bills another time. So our interest, and we'll have to decide after we've heard about the bills the first time, we'll just have to decide which ones we're going to take up with when. We also have bills relating to improvements in the healthcare system and the delivery of health to the citizens of Vermont. And I'm calling it that rather than healthcare reform. So what we would like to do as a committee, I think, is just to decide what are the next steps that we should be taking or that we can take so that two things happen. One, we want to ensure that healthcare is affordable and accessible to the people of the state of Vermont. That is absolutely number one. It's critical. We are all here. And as I think that Senator Balint's comments on the floor today were right on target, that we're concerned about the people we represent, and we want to make sure that they can afford the health care they need when they need it and where they need it. And so when you say when they need it, where they need it, that brings up the second issue for us. And that is, how do we ensure that the care that people need is available when they need it? So there are places in our state, for example, where nursing home facilities and other care facilities are just non-existent. They're disappearing. Similarly, we know that primary care is had some difficulty. So next week, we'll have some time to look at primary care a bit and start our discussion on that. So each of you has an interest in a different area of healthcare improvement and healthcare reform. And so I want to make sure that your interests are addressed, and that we, as we go forward and as we decide to put our bills up. So I know that the new bill today, whatever that was, and S-120, as we put those up, that they become integral to the discussion of some of the bills that we're reviewing from the House. So there may be some attachments, some improvements, and some changes that we can make to House bills that will take steps forward for healthcare affordability and access. So just want you to know that has been all through the pandemic. That's, I think, what a lot of us have been thinking about, and certainly is something that I never stop thinking about. So that's our goal. But at the same time, a reminder, there's so much. The budget's come over from the House. There's a significant amount of work within the budget that entails work on the part of our committee. So I will be communicating with appropriations, but also asking Joint Fiscal to come in and give us an overview of what is in that budget that relates to our committee. I know there's some reach up stuff. There's a whole bunch of issues. And, you know, when we start talking about the budget and we talk about base funding for things like our designated agencies, and those agencies are so critical to the treatment of our mental health treatment, our substance use disorder treatment that has seen an escalation during the pandemic. So we will take a little bit of time going through the budget. I don't have a timeline on that yet, so I can't tell you when that will be. But again, we'll try to make some of our recommendations to appropriations. And I've been receiving emails, as you probably have, about the needs that are out there for our parent-child centers. Well, we've already heard testimony about that. For some of our long-term care facilities, and on and on and on. And childcare is just another part of that long list of concerns that we have, welfare concerns that we have. So we have a lot of work to do. So we'll try to do it as efficiently and effectively as we can without leaving folks out. So I want to make sure that your interests are included as we go forward. We're not going to do it all at once, but we are going to do it. And then, So we have the bills, we have our interest in reform efforts and improvements to affordability, we have the budget, and then we also have the American Rescue Plan and funds that are there. And how those funds intersect with the budget is not our job, but our job will be to identify some critical needs that and gaps that we can help fill as a result of the pandemic and going forward. So, I don't know, is there anything else? This, we have a lot in front of us, but we're capable and we can do it. I have no doubts that we can do this. And there are issues that are going to be facing us that are not without controversy. And some of the bills that we'll be looking at will offer controversy, but I think we know, at least I believe we have a sense of what our responsibilities are for the people we represent and for the health and welfare of citizens of the state. So we need to advocate for that. Yes, there's a lot of controversy coming up in just about everything that we're going to be facing. So we'll face it. All right. Any comments, questions? Well, so now I do have the question for you. We heard last Friday from, I forgot what day it was. Correct me if it wasn't Friday. We heard from the Green Mountain Care Board regarding sort of that reimbursement study, and it got to be a little bit wonky, and it does get wonky. The board would like to continue that process, and I think we might invite them in and try to at least get an understanding of what's in that report. It's not, for me, it's not a primary target for discussion, but it is informative. So that's the way I look at that report. And I think we should, and the work that's been done is amazing. The other thing I guess I would recommend is if you have some time to go out and look at the Rural Healthcare Task Force report. It does include some flow charts on some of the issues that are concerned to us. And it does have a significant amount of data about where healthcare facilities and services are offered across the state. So as we hear testimony from our nursing homes, long-term care, DAs, SSAs, primary care, as we hear from the providers of the world, it'll give us an understanding of where the gaps are. So it's an excellent report. I can't emphasize that enough. Let's see, I've been going back and looking at a lot of the reports that we've had pre-pandemic and then post-pandemic. So if you have a chance to do that, it might be helpful. And if there are any of those reports that you think it would be helpful to go through in committee to inform our process, let me know, because we can do that. We can take, doesn't need to be a long update, but just to answer questions. Anything else? Oh. Senator Cummings, I can't tell you how good it is to have you back. And I just hope that you're able to stay with us as much as possible because we missed you greatly.
Thank you. I've missed being here and I'm be here as much as I can.
Good. All right. Okay. You know, I don't have anything more, I don't think. After we leave the committee, I'll remember something or think of something that perhaps we should have discussed, but I think we're good for now. I just looking at the bills that we have coming up, beginning on Wednesday. Yes, I guess the difficulty that we're going to face as we go through a number of the bills that we have coming up are issues around funding. So extending Dr. Dinosaur, Medicaid rates. When we start looking at mental health, it might be helpful for us to understand what some of the funding needs are in our mental health services environment. So all of those things will take a visit or a trip down the hall to finance and or appropriations. So our goal is to evaluate the policies that are embedded in these bills and to ensure that they are the right policies. But at the same time, we have so many requests that involve money and financial and revenue, appropriations and revenue, insurance policy. We have so many of those bills that we need to keep an eye to what's possible. So I ask you as we go along to keep a list, because I'm keeping a list. And I don't know how we do it all. I really don't, but we want to do as much as we can. Senator Hooker, did you have your hand up? Go ahead.
I'm just thinking about the rescue money, and when are we going to know what
Yes.
we do with that money? And so everything is just kind of
In
floating
limbo.
right now.
So,
for sure.
yeah, so I'm waiting to hear that we have an update on guidelines, and we'll get that on our agenda again, so we have an understanding of what we can do and what we can't do. And that does affect what we can do in terms of the budget.
Of course.
Listen, we know that there are reports coming in on that indicate that we need to increase our base budget for a base reimbursement and base budgeting for our substance use disorder system, for our designated agencies, for our mental health system, for our disabilities folks. They all need this. There's no question about it. We need to start prioritizing. But we also, I agree with you, we need to know what's out there for what's possible with our federal dollars.
Okay. Great.
Yeah. So keep your list. And I did hear about a really remarkable program that's going on with the within the disabilities community, and I will probably invite them in to talk about what they're doing. It's pretty exciting. All right. Anything else? So the sun is out where I live. Is the sun out where you are? I don't know.
The sun is out here, but I don't know if any of you know what went on in Montpelier on Friday. My neighborhood had some kind of a microburst. Neighbor heard a sound like a train. I've been told that's typical of tornadoes. I have a white pine, it's probably 100 feet or more tall. It was snapped off 10 feet up, and it's in the neighbor's yard.
So you probably had the end of the Middlebury tornado.
From Middlebury, something went through here. There's a tree down at National Life. There's another white pine, and this is a middle pine in a whole line of them. Same thing, snapped right off up, not out by the roots, not blown over, snapped off.
Wow.
It lasted about 3 minutes or that, but it was kind of surprising. And the lights went out again, at least up here, and were out until 5 o'clock. Up at the hospital, 5 minutes away, they had no idea what I was talking about when I got there.
Wow.
That's That's
Nothing.
the unique characteristic of
Yeah.
tornadoes and microbursts. Yeah. Wow.
This is the first
through-
day in about a week that we haven't had consistent winds. I mean,
Wow.
in
Yeah,
Rutland,
there's been a lot of wind,
a lot of wind, but
but it's March.
damn
There's
it.
supposed to be wind.
Yep.
A lot of drying out, which is good, but it was really strong wind for a while. Yeah. And for days.
So, so I'm going to suggest, Nellie, that we could go off YouTube. I think our committee is winding down. We may have a few things to talk